Automatrix kit, we're going to have you use this in lab. You have different options for sizes of matrix bands. So this is sort of a all-in-one Toffelmeyer. It's got the little retainer on it for you. It's a little complicated, but what we would like to make sure is that everybody uses this at least once in the clinic, because we don't want, or in the lab, we don't want to be the first time you use it in the clinic. Because there's a little bit of a learning curve with it. So you will check these kits out. You won't all have these either. There's a couple of little fancy schmancy tools that go with it. So there is a clipper, and this is the little thing, I don't even know what it's called, Automate tightening device. So what this does is this actually loosens or tightens your band, and you put it into this hole right here. You can loosen or tighten, and you turn, if you want to pan out a little bit, you actually just turn the handle like this. So there's some spring formation in here that actually opens and closes this, so your job is actually very easy tightening and loosening your band. So we're going to put this band around the same tooth that we already put the pins in, and it's going to slide in, and you're going to, just like anything, you're going to want to put the retainer portion on the side where you have the most tooth structure. So in my opinion, these Automatrix bands are really probably designed for teeth that are really broken down. Some people use them for everything. I'm not one of them. I don't think Dr. Radnicki is, but they can be useful. I'm working on this typodont with hard gingiva, so it's a little difficult. It doesn't have any squishiness to it. If I was working on one that had some squishy gingiva, this would probably slide down in here a little bit better. But my retainer portion is to the buccal. This tooth is obviously very broken down. We've already placed one pin. We've already removed one pin and burned the corner of the tooth. So what I'm gonna do is I'm gonna hold this down in place, and I'm going to tighten it. This is gonna tighten up around the tooth. I should be able to feel it start to snug up. When it gets really snug, there should be a click. Then at that point, I'm gonna back this off, and I'm gonna wiggle that out. So it's now locked in place. I can now place my wedges, or I could have placed my wedges ahead of time as well, before I tightened it. If I felt like it wasn't stable, I may have wanted to place my wedges earlier rather than now. That's kind of a feel you get depending on clinically how you want to do this. And of course, it's a matrix band, so I want to burnish it in place. So I'm going to get in here and really push on it so it comes up against number 31, and push on it again so it comes up against number 29. These are maybe not the best size wedges. In fact, on this mesial, I would probably pick a little smaller wedge. I've filled the embrasure probably a little bit too much with the size of that wedge. Maybe switch down to a smaller size wedge. Okay, so this is stable now. I'm gonna condense all the amalgam in here. When it comes time to take this band off, it's a little different too, because remember, you clicked it into place and it locked into place. That's where these come in handy. These are the clippers. There's a nice little guard in there in the kit that actually comes with it. That goes on there. There are several in the kit. These are also not disposable. Please do not throw them away. Don't throw this away. This little thing helps. Now, in lab, it probably doesn't matter, except for you could probably get this caught in your eye. In a patient's mouth, or with a rubber dam on even, this little plastic thing takes care of where that little thing is gonna get clipped off. So what I'm gonna do when it comes time to take this off, and all of my amalgam's in there, remember, I'm going to stabilize the matrix band with my hand, because I just packed a brand new amalgam in here and I don't want it to shift. Then I'm gonna clip. If everything works right, which of course, maybe today things don't want to. It doesn't appear that this clipper is any good. This should fall apart. It did, mostly. But you can see how things don't always work exactly the way they're supposed to, even when you're used to using something. But now this is really no different than your other matrices or your Tafelmayer. At this point, I would put my fingers over top. I'm going to shift this around, and I'm going to take the wedges out. And then I'm going to very carefully hold one side and tease that out past my new amalgam, pull it around, and tease that out past my new amalgam. And then I'm off to the races to make that look gorgeous.